Many people involved in automobile accidents experience chronic low back pain. Often, the exact cause of this back pain can be difficult for doctors to determine. Quite often, victims of a car wreck can suffer for years from low back pain without knowing why they are hurting. Low back pain is reported in more than 50% of people that seek medical attention following an automobile accident. Of these, 30 to 42% continue to have low back pain 6 months after the wreck. 20% of these people have low back pain 7 years after the accident. It is important to determine the exact cause of chronic pain if at all possible. This is because making a correct diagnosis regarding the cause of chronic back pain improves the likelihood of the person having a good outcome when a treatment is chosen for a specific structural problem rather than a generalized nonspecific treatment. Additionally, since motor vehicle accidents are often followed by lawsuits, reliably determining the specific injury responsible for a chronic pain may have significant legal and financial implications. In 2011, a study was published in the journal Pain Medicine entitled Structural Etiology of Chronic Low Back Pain Due to Motor Vehicle Collision. In this study, the authors tried to determine the most common cause for chronic low back pain following an automobile accident and the comparative frequency of these causes. The study evaluated 27 patients that had chronic low back pain lasting greater than 3 months and caused by a motor vehicle accident. On average, the patients had had low back pain that had lasted for 24 months. The authors discussed the forces exerted on the lumbar spine during a motor vehicle collision. They said, sudden deceleration during MVC increases axial loading of the occupant's spine relative to the vehicle inertia and body recoil. During head-on MVCs, the chest is held back by shoulder strap seatbelts as the body heaves forward, increasing axial load on more caudal segments and the anterior column categorically. A rotational force generated by the shoulder strap can lead to asymmetric axial loading and torsion. Both the intervertebral disc and facet joints are exposed to potentially injurious forces during an MVC. The axial load borne by the lumbosacral spine may introduce shear through the sacroiliac joints. When the lower extremity is in contact with an immovable object, forces are transmitted to the trunk through the sacrum. During the impact of an MVC, an occupant may fixate a lower extremity on the brake pedal. Consequently, the force transmission occurs through the relatively fixed lower limb into the pelvis. The combination of this upward and posteriorly directed force and the axial compression experienced through the lumbar spine may lead to shear across the involved sacroiliac joint sufficient to injure the joint. We did not collect data on patient-specific lower limb positioning during the MVC. Regardless, the SI joint is exposed to potentially injurious strain during a MVC, particularly if the patient's lower extremity is planted on floorboard or brake pedal. Each of the study subjects in this article underwent diagnostic injections to determine the cause of their pain. The structure studied included the lumbar facet joints, the sacroiliac joints, and or the lumbar intervertebral discs. The specific blocks chosen were determined based on the clinical presentation and pain pattern. If a diagnostic block in the facet joints or sacroiliac joints improved the pain significantly, a confirmatory diagnostic block was administered to make sure that the initial result was not due to a placebo effect. For those patients whose clinical presentations pointed more toward a disc as the primary pain generator, provocation discography study was performed initially. If the discography study was negative, then facet joint blocks or sacroiliac joint injections were then performed. At the end of this study, the authors concluded that in patients that have chronic low back pain of 3 months or more following a motor vehicle accident, 56.6% of the time that pain was originating from an intervertebral disc. 25.9% of the time, the pain was due to pain originating from one or both of the sacroiliac joints. 18.5% of the time, the pain was due to one or more of the lumbar facet joints. The study demonstrates that with precision interventional pain management diagnostic procedures, the specific cause of low back pain can be determined in a large majority of cases. In many of these cases where there is chronic low back pain, the patient is diagnosed with lumbar strain or lumbar sprain, even though the pain persists for years after the injury. While such sprain injuries can cause pain that lasts for 4 to 12 weeks, the authors state that there is, quote, no evidence that such so-called soft tissue injury can cause significant chronic low back pain months to years after the injury, close quote. Often such patients are accused by employers, colleagues, friends, and even family members of exaggerating or faking the severity of their complaints. Others are accused of complaining of pain that is all in their head. By using systematic diagnostic protocols, such as those described in this article, the specific cause of chronic pain can be made to both legitimize the complaints of those suffering, as well as to help their treating physicians form a proper care plan to help them.